Hi, Sarah.
Hey.
Hi. So Sarah and I have been working together a lot this week, reporting on a reporting project, a co-reporting project. And we've actually just finished publishing our Friday issue. So we are it's all fresh in our minds. And we're recording early to get ahead of the holiday break next week. We have a lot to talk about. So I think I'm just going to power through the headlines. And then we can jump right into it. So story one was reported by Sarah and myself on Oncofertility and coverage mandates that have expanded to 21 different states and DC due to political momentum. Story two is a Q&A between Shane Jacobson and Paul Goldberg. Shane Jacobson is 2 months into his job as CEO of the American Cancer Society and American Cancer Society Cancer Action Network, or ACS CAN, and he talks about his to-do list for ACS. And then we have a guest editorial by Mikhail Sakaris about Richard Pazder. We also have two obituaries this week. Montefiore's Einstein director Edward Shue died of glioblastoma at age 66. And Arnold D. Kalushny, longtime advisor to the NCI and health services researcher, died at 87. And then we also had a sponsored article by ASCO on GI cancers symposium. Story one, Sarah and I have been reporting this story for a few weeks on oncofertility mandates in the US. There's a lot of heavy lifting, especially on the policy side of things, which Sarah shouldered. And I really want to talk to her about that. But I think first I just wanted to kind of introduce our main narrative character for this story, Mia Sandino, who is this lovely, glamorous 26-year-old living in LA with her cats, her many cats. And she has been living with osteosarcoma for about 7 years. It has reached the point of incurability. She found out in September 2022. And she's a regular on a podcast as well. Osteo is the name of their podcast. It's called, it's Spilling the Tea on Osteosarcoma. And it's hosted by MIB agents. You can check out her story from her own perspective there. But, she's so articulate and good at this and better than me. So we're going to actually include some of the audio from the interview that I had with her and let her kind of talk in her own voice.
I have stage 3 metastatic osteosarcoma that was first diagnosed in September of 2018 as stage 1. I had a 2.5-inch tumor break through my right proximal tibia, and being a very naive and invincible feeling 19-year-old, I didn't put two and two together that this area of the knee that I had sprained could be something other than an injury that I had acquired or re-aggravated by, walking up and down stairs and living on the third floor of my sorority house. And, Seattle's very slippery when it rains. And, it was very easy to think that I had just re-aggravated a previous MCL sprain of that leg. And it was my right proximal tibia, and so meaning the inside of my right tibia. And so it was a very similar area to where I had sprained it previously.
Okay.
So it was very kind of hard to differentiate that pain. And, once they found the tumor, I was a little bit of a different case than the usual osteosarcoma patient, because when they went in to do my bone biopsy for the tumor, it actually came back as a benign giant cell tumor. And it wasn't until after they went in and fully took out the entirety of the tumor that they realized that the back half of it had mutated into osteosarcoma.
So, this story it's about fertility and oncofertility, but it's also kind of about all the gray areas and the nuances and questions, especially for young people surrounding the oncofertility conversation, which is kind of new, by the way. ASCO only created a standard of care guideline for fertility preservation for cancer patients in 2006, and there's been some updates since then, but in those first guidelines, they deemed fertility preservation for cancer patients as a medical necessity. But the reality is that in the US, most people just don't have benefits that cover this. And it's extremely cost prohibitive. So, we've had this paradigm shift, which is a word that Paul does not love, but that's what's happened over the past decade.
Paradigm shift. He's not here.
Yeah, paradigm shift. I like it, where oncofertility counseling, the conversation in the clinic is becoming more normalized. But then, we have this kind of paradox where we have these informed patients now who are looking at extraordinary costs on top of the financial toxicity that already exists for cancer treatment. And so it's just kind of like adding a layer to the financial burden, and their insurance doesn't cover it. So, that's kind of where we're at. In Mia's case, she needed to stop her schooling. She was on the MD, PhD neurobiology track when she was diagnosed, just a few weeks before starting her sophomore year, and had to withdraw. She was presented with fertility preservation options at the get-go in her first appointment, like diagnosis, and also we can retrieve your eggs if you'd like, but ultimately decided not to undergo fertility preservation. There was just too many uncertainties. She had no idea if her insurance would cover it, had no idea if she really wanted kids in the future, and most importantly, it would have delayed her treatment for about 6 to 8 weeks. So that's Mia's story. The news here is that there is this wave of new state mandates requiring private insurers to cover fertility preservation for cancer patients. And I'm going to shut up and I'm going to let Sara talk about that because she really did a lot of the heavy lifting in that area. I wanted you to first talk about your reporting experience, how you found your sources, and then whatever you think is most important about this.
Yeah. Well, I guess I'll just first start off on my initial impressions when you first came to me and you're like, hey, there's a story that I want to report on. And I had never even heard of oncofertility before. I wasn't aware that this was kind of a certain kind of existentialism that a lot of young cancer patients were faced with. I mean, I'm 29 right now, and I'm considering my own kind of family building and what I want for my future. And I can trust me, there is a lot of existential dread going on right now. But obviously add that on top of it, like, a cancer diagnosis, which in and of itself raises so many different types of existential questions. And so it's really an unfair position that a lot of young people are put into, especially when it's not covered by insurance. It's not necessarily a question of whether I want to freeze my eggs or not. It's more of a question of like, do I even have the choice to for a lot of people? And that tends to be the situation that the vast majority of folks find themselves in because this is just largely not covered by insurance. But that's slowly changing because of the advocacy work that has happened over the past 20 years. I was able to speak with 2 advocates who are also cancer survivors themselves, and they've been working on this for a long time. They've been going to lawmakers' offices across the country. They've been canvassing in their districts, just man on the street, handing out flyers. They've been really trying to find champions in state houses, like people that care about this issue, and then getting them to go on the Senate floor and to fight for these bills or to go talk to the governor and be like, hey, we should pass this in the budget. Those 2 people are Amanda Rice with the Chick Mission and Joyce Reinecke with the Alliance for Fertility Preservation. And Joyce has been in this for a long time. She was first diagnosed with cancer in 1998. And around that time, I mean, it was barely on the radar of physicians. From her kind of anecdotal experience, she found out at what she said was the 11th hour after she had gotten surgery and, before they were, having conversations about chemotherapy. She actually didn't end up getting chemotherapy in the end, but it was a possibility that she was talking about with her physicians. And very last minute, they were like, hey, by the way, this might affect your future ability to have children. And throughout, since then, she has been really trying to work towards physician education, making that towards the standards of care. Another big thing that advocacy groups have done are build financial aid programs, whether that's through philanthropic donations to try to self-pay, to provide the funding to self-pay. But they've also negotiated rates with pharmaceutical companies or partner clinics to try to get the price down for these particular patients. I would say the more recent advocacy wave has really centered on these insurance mandates on the state level. And over the first insurance mandate passed in Connecticut in 2017. So it's been about 10 years in the making. And we see so many different types of bills. There are bills that cover all different types of people where this is medically necessary. So not just cancer patients, but also sickle cell patients or lupus patients. We see other bills where it is strangely just breast cancer and ovarian patients. which doesn't really make a lot of sense because your fertility can still be affected regardless of the specific tissue type, the kind of cancer that you have. But in a lot of ways, advocates are like, we'll take whatever win that we can get, and some coverage is better than no coverage. And it's this process of slowly chipping away at it. Maybe first they're going to focus on a bill that just focuses on ovarian and breast cancer patients. Next level might be, let's try to expand Medicaid coverage. And I've also heard some whispers about a potential effort to work on a federal mandate. So there are all these different types of bills all across the country, and it's this real patchwork of insurance mandates. Some states have it, some states don't. And there's like a variation in all those states as to what is actually required and what isn't.
Yeah, yeah, yeah. I always think about, navigating insurance as, a healthy adult, I guess, is hard enough. Like, I can't imagine trying to navigate all these things. It's so layered and so nuanced, depends on where you are, depends on where you are in your diagnosis, and just the amount of choices. The decision fatigue, I can only fathom.
Even when there are bills that require insurance mandates, there are still a lot of bumps in the road. So, your insurance company might require an infertility diagnosis, which a cancer patient who hasn't gone through chemotherapy yet wouldn't necessarily have. Plus the timeline of the whole thing. When somebody's diagnosed with cancer, they're running against time, they're trying to get into treatment as quickly as possible, and every day matters. And so going through the procedural process of getting a diagnosis, submitting it to the insurance company, having them deny it, this whole thing really has some measurable impacts on people's treatment as well.
Yeah. 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 It truly is a part of the financial toxicity conversation, which, I could go on about forever. It's just so vast and multifaceted. But one thing that I found really interesting about your reporting, and I guess I kind of knew this already, but seeing it kind of laid out state by state was really interesting, is that this is truly a bipartisan issue. We're in this political climate right now where the president is championing fertilization, calling himself the fertilization president, expanding IVF access. We're having this huge decline in birth rates. So you'd think that these policy changes would be a little bit more easy coming, but why, from your reporting, why is it such a slog? Why has this been taken so long to kind of get these into effect?
I can't say with 100% authority, but my gut instinct is that this is just the reality of the legislative process everywhere, in towns and cities and states, and then on the federal level too. It's that you have to find somebody who really cares about the issue, who has a personal connection. A lot of the advocates that I talked to, they said, oh, okay, we were able to find a lawmaker who, had their own cancer journey, or had a friend who went through this entire experience themselves, or was like the mother or the daughter, or, just had some kind of personal connection where they got it, or even that they had a constituent in their district. And so at the end of the day, you just need somebody to fight for you. And part of the art of advocacy is finding that person. And it might take a lot of time.
Yeah. There's one advocate too that you introduced, but I wanted to know more about Amanda Rice. She had her own kind of extraordinary costs that she paid for her fertility journey. Could you talk a little bit about that?
Yeah, so she ended up going through 3 rounds of egg freezing, and that cost her about $55,000 out of pocket. She's very fortunate, and she said this, she felt very, grateful that she was able to afford that. She works in finance in New York City. And she did have insurance during all 3 times, and different insurances, and all of them got denied, including at one point, her insurance explicitly offered fertility benefits, but because she didn't have that infertility diagnosis, she was denied. So she had to pay out of pocket. And understanding that this is really not feasible for the vast majority of people out there is what motivated her to work on the Chick Mission and to start the advocacy organization.
Yeah. It's just a huge amount of contradictions. Yeah. Well, and I should mention too, the kind of a last variable in this already extremely complicated kind of landscape of oncofertility is that cancer incidence is also rising in younger people right now. So we're kind of at this moment where there are going to be more cancer survivors than ever, kind of entering into this cancer as a chronic disease territory. So this issue, I'm predicting, if you will become increasingly, more prevalent and more important. So kind of to circle back to Mia, our main character, she pointed out that, kind of speaking of, the existential pressures of, I guess, navigating fertility as a person with cancer, living with cancer, especially an incurable disease where you don't know your timeline. She said she's trying to live her best life, and she's decided she doesn't want to have kids, even though she does love being around them. And yet, this conversation about fertility preservation, just kind of works its way into her everyday life. Whether it's a family member at Thanksgiving wanting to know about her, if she's tested, her genetics, or it affects her dating life. She's in her, almost 27 years old now. And yeah, it's a conversation that comes up when she's, getting to know people. And so it's just this, even though she's already decided, I'm not going to be retrieving my eggs, it's still, just kind of a looming thing over her life. So she said this conversation, just the normalization of this conversation about people with cancer and family building is so important. So yeah, this was a really, I think I was saying, just powerful story to report, as always, with patience. But Mia especially was just such a wonderful character to be able to speak with, just so vibrant and full of life, having been through what she has been through. Like that's so, it just impressive to me. So such a joy to speak with her. I'm so thankful that she was so vulnerable and willing to talk to us about this. So yeah, I hope you enjoyed your reporting too. It's so fun to co-report stories like this where, we kind of we come together with all of our findings, and then we kind of create this structure that just ends up flowing and working really well. So thank you for your reporting. It was really awesome to do this with you. I hope we can do it again.
Let's do more. Let's do more. More.
All right. Well, thanks so much for being on the podcast with me. And thank you everyone for listening. We'll talk to you next time.